I understand there's lots of concern regarding COVID-19 on the pregnancy. Right? I have some good news to share with you. First of all, studies have shown that COVID-19 does not actually affect the pregnancy much, not in terms of increased rate of miscarriage or fetal deformities. So that's a good news, isn't it? Right? Secondly, being pregnant doesn't make you more vulnerable of contracting COVID-19. Neither does it make the disease worse just because you are pregnant. So that's the second good news. Thirdly, in the event that you really you happen to be infected with the virus, well, as in majority of the case, if you are fairly well or the symptoms are pretty mild, it doesn't seem to affect the pregnancy much. And after you recover, we can just allow the pregnancy to progress as per normal. Well, again, in the rare event that if you are severely affected, then if you are not in a good state of health, then it basically reason that we do sometimes need to effect earlier delivery.
If you suspect that you have come down with the COVID-19 virus, do not be alarmed, do not panic. Go and see either your GP or go and see your gynecologist, your obstetrician, and then you would be directed accordingly. For a patient who is confirmed to have the COVID-19, they would be sent to one of the restructured hospitals around the island, depending on where you stay. If there is a clinically significant gynecology or obstetric issue that has to be dealt with, then you would be sent to either NUH or SGH, and you would be treated there, you would be observed there. So if you are confirmed, then you would be admitted into one of these hospitals until you are cleared of the virus. So usually they make sure that you have had 2 swabs which are negative before you are discharged.
Far as we know, and from the reports internationally as well as from our Singapore patients, the predominant features include fever, cough, and then some of them of course get nasal congestion and a little bit of runny nose. There are also some reports of diarrhea and vomiting. So this is very much in line with what's happening overseas as well. I think the complications, thankfully so far, in our local experience are rare. But overseas, there have been reports of course, pneumonia and even leading on to multi-organ failure. There are rare complications as well. There's an evolving situation of the pediatric inflammatory multi-system syndrome. So basically a overreaction of our immune system that results in multiple organ systems being affected.
The incidence of COVID is much higher in adults and in the older population. The number of children being affected by COVID is much lower. They find that the children's immune system is better and therefore they are more resistant. We really do not see very much the horizontal transmission, we call it. That means if in a childcare center, you don't see one child passing to another child. They also find that the children who are actually infected are usually infection from mother or father or grandparents in the home. So it's usually household transmission. So, and also in children, the disease is usually much milder. However, of course, recently there is a write-up by Europe, United States and UK where they describe this thing called the COVID, the cytokine storm, where they present KD-like or Kawasaki-like disease in the older children or the young teenagers. So this one we do not see in Singapore, we do not see in China or even in Hong Kong and Taiwan. So there could be some genetic variation in the disease manifestation. So generally up to now in Singapore, the disease is relatively mild in children.